Imagine your tooth has hurt for an entire week. At first, it was only a dull ache. You could still eat. You could still sleep. You told yourself it would disappear on its own, but it did not. Each day, the pain became stronger. Now it pulses with every beat of your heart. It spreads through your jaw, climbs toward your ear, and pounds against the side of your skull. You have barely slept in 3 nights. You cannot chew on one side of your mouth. Cold water feels like ice being pushed directly into the nerve. Warm food makes the pressure worse. Even touching the tooth with your tongue sends a sharp shock through your face. Then your cheek begins to swell. Today, you would call a dentist, receive an X-ray, get an injection to numb the area, and perhaps leave less than an hour later with the infected tooth removed. But imagine living 2,000 years ago. There are no X-rays, no electric drills, no sterile gloves, no reliable antibiotics, and no injection that can make half your face completely numb. There is only the pain and a person standing in front of you with a metal instrument. For most of human history, dental surgery was not something people scheduled for comfort or appearance. It was a desperate decision made when the pain had become worse than the treatment, and the treatment could be terrifying. You enter a small room lit by sunlight from an open doorway or the weak flame of an oil lamp. The person treating you may be a physician, a healer, or someone known for removing painful teeth. You sit on a wooden stool. There is no reclining chair, no machine beside you, no assistant calmly explaining what will happen. Someone may stand behind you to hold your head still. The healer asks you to open your mouth. The smell of herbs, wine, metals, sweat, and old blood hangs in the room. They look at the swollen gum and the dark, damaged tooth. There are 3 immediate problems. The first is pain. Ancient people had access to wine, opium, and different medicinal plants that could dull suffering or make a patient sleepy. But these substances were unpredictable. Too little might do almost nothing. Too much could make the patient dangerously ill. You might feel dizzy, you might feel exhausted, but you would probably still feel the tooth coming out. The second problem is the tooth itself. A healthy tooth is held tightly inside the jaw by roots, ligaments, gum tissue, and surrounding bone. Pulling it is not as simple as grabbing it and yanking upward. If the practitioner uses too much force, the tooth may break. A root may remain trapped inside the jaw. The surrounding bone may fracture. The jaw itself could be injured. Ancient medical writers understood this danger through experience. Roman instructions describe separating the gum from around a painful tooth and rocking it repeatedly before attempting to remove it. The goal was to make the tooth loose enough to pull without destroying the bone around it. So the procedure begins. A narrow metal instrument is pushed between your gum and the tooth. The healer works around it slowly, separating tissue and loosening the edges. You taste blood. Then they grip the tooth and begin moving it. Forward, backward, side to side, again and again. Every movement sends pressure through your jaw. You try to pull away, but the person behind you holds your head still. If the tooth is badly decayed, the crown may be hollow and fragile. The forceps could crush it before it comes free. Some ancient practitioners attempted to strengthen damaged teeth by packing material inside the cavity before gripping them. Then the forceps tighten. The healer pulls. For several seconds, nothing happens. Then you feel something tear deep inside your jaw. The tooth comes free. But the procedure is not necessarily over. That brings the third problem: infection. Ancient healers did not understand bacteria as modern medicine does. Their instruments could not be sterilized using today's methods. The wound inside your mouth would remain open, surrounded by saliva and microorganisms. If part of the root remained, the pain could continue. If bacteria spread into the jaw, the swelling could become worse. If the infection entered the bloodstream, a damaged tooth could become fatal. In the ancient world, the extraction might save your life. It might also create an entirely new danger. And Rome was not where dental treatment began. Thousands of years before Roman physicians wrote instructions for pulling teeth, people were already attempting procedures inside the human mouth. At the ancient settlement of Mehrgarh, in what is now Pakistan, archaeologists discovered human molars containing carefully drilled holes. The individuals had survived the drilling long enough for signs of wear to develop afterward. The holes were too controlled to be accidental. The likely tool was a small bow drill similar to those used by craftspeople to make beads. Imagine another patient sitting on the ground while a healer places a sharp piece of flint against a damaged tooth. A cord is wrapped around a narrow wooden shaft. The healer moves a small bow backward and forward. The shaft begins to spin. The stone tip presses against the enamel. Enamel is the hardest material in the human body, but a sharp stone rotating rapidly can slowly grind through it. The vibration travels through the patient's entire jaw. Stone scrapes against tooth. Powder collects inside the mouth, and as the drill moves deeper, it approaches the sensitive tissue beneath the enamel. We do not know exactly what every drilled tooth was meant to treat. Some may have contained decay. The holes may have removed damaged material or relieved pressure inside an aching tooth. But the discovery reveals something remarkable. Humans were performing delicate dental work thousands of years before written medical science. They were not doing it because they wanted perfect smiles. They were doing it because tooth pain could destroy a person's ability to function. That pain was especially common in some ancient societies. Ancient Egyptian remains often show severe tooth wear. Tiny particles of sand and stone could enter flour during grinding. Over years, bread made from that flour acted almost like sandpaper against the teeth. The enamel wore down. The softer layers beneath it became exposed. Eventually, the sensitive center of the tooth could be opened to infection. Abscesses formed around the roots. Gums became diseased. Teeth loosened or broke. A farmer, builder, soldier, craftsperson, or ruler might survive hunger, injuries, and harsh weather, only to be weakened by a single infected molar. The pain could prevent sleep. It could make eating impossible. It could cause fever and swelling, and without effective treatment, it could remain for months or even years. Ancient healers used mixtures made from plants, minerals, oils, honey, and other substances to treat painful teeth and gums. Some ingredients may have reduced inflammation or slowed bacterial growth. Others probably provided little more than temporary relief. When those remedies failed, removal became the final option. But dental surgery required something beyond tools and medicine. It required trust. You had to allow another person to place stone, metal, or a blade inside one of the most sensitive parts of your body. The practitioner could not see the hidden shape of the roots. There was no image showing where the infection had spread. Their knowledge came from experience. Which teeth could be saved? Which ones had to be removed? Which direction should they be pulled? How much movement was enough? How could bleeding be controlled? Every successful procedure taught the healer something. Every broken tooth taught them something too. Over generations, that knowledge accumulated. People developed specialized instruments. They learned to loosen teeth before pulling them. Some cultures used wire to stabilize loose teeth. Others experimented with replacements, bridges, medicines, and fillings. Much of this treatment would appear crude or unsafe today. Some procedures probably worked. Others almost certainly caused additional pain. Ancient dentistry should not be romanticized. People suffered greatly, and many treatments were limited by incomplete knowledge. But it should not be dismissed as meaningless superstition either. The person holding the ancient forceps was attempting to solve a real medical emergency with the best knowledge and tools available. And the patient sitting on the stool understood that doing nothing could be even worse. Today, dental surgery takes place beneath bright lights. A dentist can see the shape of the roots before touching the tooth. Instruments are cleaned and sterilized. Local anesthetic blocks most of the pain. The wound can be stitched, monitored, and treated if complications appear. A procedure that once depended on strength, endurance, and luck can now be planned with extraordinary precision. Yet people still become nervous when they hear the sound of a dental drill. Their hands tighten around the chair. Their heart begins to race. They feel vulnerable the moment they open their mouth. Perhaps that fear makes sense. Dental treatment requires you to remain still, surrender control, and trust someone who is working only a few centimeters from your eyes and brain. The difference is that today, the fear is often greater than the pain. In the ancient world, the pain was the reason you came, and pain was also part of the cure. For an entire week, your tooth had controlled your life. It stopped you from eating. It kept you awake. It filled every quiet moment with pounding pressure. Then you sat down, opened your mouth, and allowed another person to pull part of your body from your jaw without modern anesthesia. Not because ancient humans were fearless, but because sometimes the only thing more terrifying than ancient dental surgery was living with the tooth for one more night.